I'm Dr. Michelle, and I want to show you how to use my tooth powder. There have actually been a lot of questions about this, and it's because it's different than just using toothpaste. So let me show you exactly what I do and what I recommend for using it. The first thing is you're just going to want to wet your toothbrush. Just get it wet, and then I shake off the excess water. So all that's going to be wet is the bristles. You dip your bristles into the powder like this, and you'll see that tooth powder actually sticks to the bristles. That's all I do. It's left no liquid at all, no moisture at all in the bottle of tooth powder. That goes to the mouth, I brush with it, I spit, but I don't actually rinse out. Why don't I rinse? Because I want the hydroxyapatite that's in this powder to stay on my teeth as long as possible. People have been concerned about the whitening one. They say it's a little gray. I do it every day and no one's ever told me that my teeth are gray. It's gone within just a few minutes of time. The saliva washes it out and it's completely gone. So that's not a problem. You know, one other concern people have is about if it's the sanitary or not. And they say that sometimes by the bottom of the bottle, it's kind of cakey and crusty. I've been using this tooth powder longer than anyone because I'm the one that actually formulated it. I've never had a cakey or crusty bottle even when I get to the very end. The key is not having excess moisture on that toothbrush when you dip it in here, and then all the powder is just going to collect on the moist bristles and leave nothing behind. At that point, you're not worrying about sharing germs or even changing the tooth powder as you're using it, and it should work great clear to the bottom of the bottle.